If you feel like your body's changing in ways you can't quite explain, your mood is all over the place, you wake up drenched in sweat, your periods are crazy, I just want to let you know that you're not alone and that could be something called perimenopause. I'm Dr. Karen Tang. I'm a board-certified gynecologist. I'm here to talk you through this natural but sometimes very confusing phase of life. We're going to talk about what exactly is happening with your body, what symptoms to look out for, and most importantly, what you can do about them. Because here's the truth. This phase of life is really natural, but it's very misunderstood, and you deserve to get care. Let's start with the basics. So menopause is defined as when you have not had a period on your own for 12 months. But the period leading up to that is called the perimenopause transition or perimenopause, and that can last for up to 10 years. So it can start even as early as your late 30s. During perimenopause, your ovaries produce less of the hormones estrogen and progesterone, and sometimes you can have wildly erratic swings in your hormones. And that's why you can feel like your mood is all over the place, your sleep, and other symptoms in your body can feel so erratic. You might notice that your periods are becoming irregular, shorter, longer cycles, or sometimes skipping periods altogether. And along with that, you might feel things like hot flashes, night sweats, mood changes, terrible sleep, vaginal dryness, brain fog. Does any of that sound familiar? If so, keep watching. We're going to explain all of it. And in general, for a deeper dive into perimenopause, make sure you join the Menopause newsletter at the link below. What's actually going on in your body? As the follicles are becoming depleted in your ovaries, your hormone levels, especially estrogen, are going down. Estrogen is responsible for so many aspects of our health, including sleep. It affects your circadian rhythms, hot flashes and night sweats. That's because the thermostat in your brain that affects how we feel temperature is also affected by estrogen. What about mood changes? So estrogen also plays a role in regulating neurotransmitters like serotonin, and that can affect things like depression or anxiety. Some people in perimenopause can even feel almost like panic attack sensations because the vasomotor symptoms, like hot flashes and night sweats, can also cause a really jittery feeling. So people almost feel a panic sensation. If you're feeling any significant mood symptoms, please make sure you see a mental health professional like a therapist or psychiatrist in addition to your gynecologist. And weight gain, especially in your abdomen, that's because estrogen affects how your body stores fat and how it processes metabolism. Now, perimenopause is a natural phase of life, but that does not mean that you have to suffer through it. So if you're experiencing any symptoms that are really affecting your quality of life, your ability to work, your relationship, definitely go talk with your doctor. So do you need any tests to tell you if you're in perimenopause? And the answer is usually no. We can figure it out based on your story, what you're feeling, and your period pattern. If you're in a typical menopause age range, we would actually treat you based on how you feel and not the numbers. And the reason is your hormones are fluctuating so much that they'll differ day to day. And we actually treat people based on how they feel and not the number in the hormone tests. Is anything I'm saying resonating so far? Definitely drop it in the comments. I think it's really helpful for people to see how many other people are going through the same thing and that you are not alone. And if you find this video helpful, please give it a like and share because it just helps us to reach more people with this essential information. So let's talk about solutions because yes, there are definitely effective treatments. So probably the most effective is something called hormone replacement therapy, or now we call it menopause hormone therapy. And menopause hormone therapy can be a game changer. It's basically replacing the estrogen that your ovaries are not producing as much of, and it helps to relieve symptoms like hot flashes, night sweats, vaginal dryness, mood changes, brain fog, and poor sleep. It can even protect your bones. It's FDA approved for prevention of osteoporosis. But hormone therapy isn't for everyone. If you have certain medical conditions like breast cancer that is responsive to hormones, your doctor may recommend other alternatives. First, antidepressants like SSRIs or SNRIs. These can actually help significantly decrease hot flashes and night sweats, as well as help with mood regulation. Second, a medication called gabapentin, which is usually actually used for things like nerve pain, like fibromyalgia, but it also actually helps with both hot flashes, night sweats, and sleep. Third, a new class of medication called Veozah, which works on receptors in the brain, and it's FDA approved for treatment of hot flashes and night sweats. Next, for vaginal symptoms like vaginal dryness, pain with sex, and irritation, you can use moisturizers or lubricants. Now, an interesting fact is that vaginal estrogen has almost no contraindications. Almost none of it absorbs into your bloodstream. So even most patients with breast cancer can even use vaginal estrogen. And finally, lifestyle changes. Now, this is something that all of us should look into as well. So stopping smoking, limiting alcohol, ensuring good exercise and nutrition, and considering things like omega-3s for heart health or supplements like calcium and vitamin D for protecting your bones. And something really important to ensure is good sleep. And that is because sleep can affect so many other aspects of your health, including your metabolism, your weight, your mood, and things like brain fog. Some people ask about alternative or herbal remedies like soy or black cohosh or flaxseed. Now, the evidence about this is limited. They are definitely not as effective as things like hormone replacement therapy, but you can definitely talk with your doctor about them. It's also very important to know that perimenopause and menopause actually increase your risk of other health issues like heart disease, osteoporosis or thinning bones, and urinary issues. And that's why it's so important to keep up with your general health and also your routine health screenings with your doctor. So to wrap things up, here's what I want you to remember. First, perimenopause is a natural phase of life, but you do not need to suffer. There are effective treatments, and if you're ever unsure, make sure you talk with your doctor because they can help you figure things out and talk about all of your treatment options. Your symptoms are real and you do deserve support. It's also important to know that you have to take care of your general health during perimenopause and menopause, including things like nutrition, exercise, sleep, mental wellness, and making sure you keep up with your checkups with your doctor. You don't have to go through this alone. I'm Dr. Karen Tang. I really hope this video helped you and that it made you feel seen, informed, and empowered. So if you found this helpful, make sure you like and subscribe and share this with somebody who might need it as well. See you next time.